Hi, I'm Dr. Mark Rosenberg, and today I'm going to talk to you about stretches you can do to get your sciatica away. Now, if you have, first of all, as a chiropractor, this is a common symptom that I see in my office. Sciatica, the ica means inflammation. The sciatic nerve is the largest nerve in the body. It's the size of your pinky. It exits out of L5 on the side, what are called the foramina. In Latin, that means holes. And they come out, it goes through this notch or groove in the sacrum, which is the lowest part of the spine, and that nerve now runs down the whole back of the leg. Now, the reason I started with that is because you have to visualize that this pinky-sized nerve is going down the back of your leg. It's trapped here. Now, there are three ways it can get trapped. You can have a ruptured disc, in which case go to a doctor. The pain will be, in really bad cases, excruciating. Get a diagnosis before you proceed with anything else. If the pain is too great to even attempt stretching, of course, use your head. I can't diagnose and examine everybody that watches my videos, so use your discretion. Be smart about it. In my book, I talk about what's called differential diagnosis, how to know when to do that, but that's a far bigger topic than I'm going to cover here in this little video. So now we have the sciatic nerve coming down here. Let's forget the disc. Let's just talk about the two other ways. L5 or sacrum can be misaligned, pinching on that sciatic nerve, or muscles around it, particularly the piriformis muscle, can be trapping it. Okay? A lot of times it's a combination of the two. So what you want to do with this video is use your mind to think about how the sciatic nerve, again, runs down the back of your leg, how it's getting trapped, and how to stretch it out. Okay, so follow with me. This is not a stretch you want to do. Watch like this when you have sciatica. Why is that? Well, if you think about the nerve is trapped here. It's like if I step on that nerve and I go forward, it's going to hurt. Normally, the nerves, when you bend forward and stretch, are sliding a little bit through these foramina or holes. There's a little bit of give as you bend forward. One of the orthopedic tests for sciatic is called Lesag's test, where the patient lies on their back and the doctor raises the leg. It's called the Lesag's straight leg test. And what happens is when the leg gets up, okay, to about there, the leg starts to hurt. If the doctor pulls the foot back forcibly, it pulls the nerve a little more, it hurts a lot. That's called Goldthwait's test. So that's not on the quiz, so don't worry about it. Those are two tests that we would use to determine how the nerve is being pinched. So again, you don't want to do an exercise that would bring out more pinching, right? So what you do is you work around it. If we put my spine here, you'll see in front, okay, in front of the vertebral bodies, there's a muscle attachment that goes to the inside of each groin. I talk about it in all my videos, and I'm not going to go into the details of how to stretch it. You can find them on my channel. It's called the psoas muscle. So first, to give yourself a little relief, and you might need to do this with your back against the wall, and you want to stretch this way. So it might be just enough to sit. In fact, the hurt side might be up a lot because that psoas muscle is pulling this in. So again, get this visual. If it's pulling in, okay, it's going to be squeezing that nerve. Now, this is an anterior or front muscle. So yes, you are stretching the groin. Okay, that's true. But as you start to come forward a little bit, as you relax, you're opening up that psoas muscle. So that's very important. Now, let's say, again, picture that psoas muscle attaching this way behind the abdominal muscles in front of the vertebral body into the inside of this leg, pulling this whole area together, pinching that nerve. And if I sound like a broken record, I want you to get it. What you do is you go like this and you twist a little bit. Now, you may not be able to do that at first. It might hurt a lot. So just breathe. You'll feel the stretch in your spine, but that's secondary to loosening up the psoas muscle. So what we're trying to do is we're trying to release this way. And then, of course, you do the other side. Okay? You may have trouble doing one side. Come back to it. Return to this exercise here and try and come a little bit more forward. Now, the muscle that works opposite the psoas muscle in the front is the piriformis muscle in the back, and that's located right here underneath your gluteal muscle, and the sciatic nerve goes right under that. If that muscle spasms, you will get sciatica. So some sciatica is due to the, like I said, the disc. Maybe I didn't finish this out. Some of it's due to misalignment of bones. Lastly, if the piriformis muscle's in spasm from sitting on it, from sitting on a wallet, watch my sciatica do's and don'ts. I cover all that there. If it's being trapped by the piriformis, you could stretch out the piriformis with stretches like this, okay, where you stretch like this. All right, so I'm working on that piriformis muscle right here. And just to give you a sideways view, and this is covered under iliotibial stretches. So again, I'm not going into the details. So those 3 stretches, okay, will give you a little bit of room. Okay, the groin stretch, actually to work the psoas, the spinal twist, okay, and then lastly, okay, the piriformis for those 3 muscles. Now, I don't recommend doing the plow where you bring your feet up and over your head when you have sciatica. Again, that's the same reason you don't want to stretch over the leg. Why? As you go upside down, in theory, you are stretching this, but you're also pulling, okay, that nerve root. Better to do the cobra. Even if you can only do the cobra just a little bit. I can't, okay, I've got sciatica, I can't let my hips down, but just relax into it. Now that seems counterproductive. But what happens is, again, after you stretch the abdominals, you're getting into the psoas muscle. Do you see where I'm going with this? The reason people get sciatica, it could be a sudden impact, it could be repetition, bad habits, it could be the way you sit, the way you sleep, but usually what triggers it off is some kind of reaction in the muscles, which pull the bones out. So what you want to do is you want to work on those muscle groups. Again, the psoas muscle, okay, a little bit of the groin muscles, the piriformis muscle, iliotibial stretches. You can watch that one. It's one of my first videos, and I covered a lot, and spinal twists and cobra. So you have a little package there. Now, here's the biggest piece of information. Let's say you do all those and it hurts each time, and then you do them again. So each one you hold for 45 seconds, a minute and a half. You come back and you do it. You're feeling pretty good after like 2 sessions of that. Okay? Then you decide to do one more stretch and some different stretch, and it hurts real bad, and you panic. Oh my God. Don't worry about it. Just go back to the ones that work. So for some people, twisting, they have sciatica down the right leg, twisting to the right makes it feel really good. Twisting to the left brings it on. So do those series of stretches again, but don't do the side that hurts. Come back to it another day. What we're trying to do is we're trying to open up the space where the nerve comes out. So again, if the muscles tighten symmetrically, you wouldn't have any problems. It's when the muscles tighten asymmetrically is when you get these issues. So if one of those stretches causes more pain, stop it immediately. Don't be a hero, okay? And again, not to plug my book, but I talk about the different qualities of pain, and some pains are good to push through and some are not, and you have to know that for yourself. So when you stretch, check in with you. How's that feel? And when in doubt, go to see a doctor, ask them, get a diagnosis. Again, if it's so severe you can't get off the floor, you might have disc issues. If you cough and it hurts, you've got a disc issue. Whether it's ruptured or torn may not be the problem, but you have a disc issue. So the number one thing you don't want to do when you get sciatica, you don't want to push through it. Go, I'll just finish this rep if you're lifting weights, or I'll just finish shoveling this junk in the backyard. I'm shoveling snow, whatever. Don't continue to push. It will get worse. Stop what you're doing. Okay? So I've given you a little protocol, and there's no harm in ice. With every nerve, there's an artery and a vein. Oops, lost one. With every nerve, there's an artery and a vein. It's a tight package in there. If you put ice on it, it brings the swelling down. If you put heat on it, and that package of artery, nerve, and vein is squeezed more, you put heat on it, more blood tries to flow through there, but it can't get through because everything's tight, and it starts to swell up. So it puts more pressure on the nerve. So initially, muscles feel good when you put heat on them, but what it does is counterproductive to the nerve. So again, 10, 15 minutes, 20 minutes of ice max, not directly on the skin. Bring the swelling down. Don't push the stretching. And you have a little protocol on how to stretch away sciatica. All right? If you have any questions, in the comments. Thank you.